future of regenerative medicine. I think the previous speaker, Tan Sri, has very laid down the basics of stem cells, followed by Associate Prof. Angela, who is doing bioengineering at UKM. You know, there's so much in stem cells, but so little research has been done. I think, I'm not sure about, because stem cells involve a lot of legal and medico-legal issues. You simply cannot go around using stem cells from where you harvest. So the usage of stem cells is in oncology is quite limited to few diseases, but the well-known which are treated by stem cells, or you harvest the T cells, or you call it a CAR therapy, is for lymphomas and leukemias. But lot of ongoing trials going on with other solid tumors, especially the bladder, the lung, and cancer is becoming quite a chronic issue. Second cause of death after heart disease. Stem cells, what they do, in regenerative medicine, they go and replace the damaged organ. But as we get older, the stem cells decrease. I mean, we can use it for, I'm also in the Sabah Healthy Aging Society. So, where we sort of have seminars to tell you all the ways how we can still keep young, and as we get older, the stem cells decrease. That means at older age, after 60, 70, if you got any disease, your body cannot fight it because you don't have the reserves in your body. The stem cells are usually in the bone marrow and in the tissues. So, roughly said that we have about 50 to 200,000 stem cells. As we get older, the stem cells get less. I mean, you can give a trial. I'm not suggesting. If you want to keep yourself young, you can keep on take some stem cells if you want. I mean, that's between you and the company which is selling. If you look in the Google, stem cells, there are about 30 to 40 varieties available in the market. So we need to replace the damaged cells as we get older. Now, what are the diseases which can cause low stem cells? Now, one is cancer, autoimmune disease, and also any injuries to our body due to hypertension. You can get damage to your heart, or you got diabetes, you can get damage to your kidneys. So, as you get older, your chances of getting some illness, and where you need support from the body will not be able to support you at older age. And number third is trauma. Trauma is like you have a fall. You see, that's why we say after age or certain age, if suppose somebody is age of 80, we always advise the person should not have a fall. If the person has a fall, the person has a fracture, it's going to be very difficult, number one, to operate, number two, for any rehabilitation. Now, again, we need a lot of stem cells there. So what are the examples of regenerative medicine? One is stem cell therapy. As far as I told you, the only you can try it for health purposes is up to you all. I see a lot of literature. While I was doing this talk, I became quite interested actually. It took me 1 week because I really was very interesting to me when I was preparing for the talk. Stem cell therapy maybe can be looked into. They are looking into diseases like Alzheimer's, Parkinson, even they are looking at dementia. These are common illnesses we are facing in our society. By the turn of the century, by year 2030, in Malaysia, our population of 40% are going to be more than 60. So that's alarming. I hope the Ministry of Health does look into this, that now 60% of our population is going to be more than 60 years of age. As we get older, the chances of yours running in trouble are more. So stem cell therapy, as I told you, from the oncologist point of view, only lymphomas and leukemias. But you can try that for other illnesses, or just use it as a health. That is up to you all. It's between you and the person selling. A lot of people are selling stem cells, but if in this crowd anyone taking sheep, you see, this was many years ago. I came across a lot of stem cells. I got nerve injury myself, so I was trying to look around. If anybody in this crowd using sheep stem cells from Switzerland or all these countries, Scandinavian countries, you know, I was quite surprised. They say there's no stem cells there, and that is the most expensive in the market. If you want to buy stem cells coming from Switzerland, from sheep's placenta, it's very expensive. Now the 3D tissue engineering, I think just now Prof. Angela has already explained to you all how they are trying to develop stem cells out in a petri dish and then inject it into a patient. I mean, I can take your skin tissue of any part, small part of the abdomen, and I can regrow the stem cells and then give it back to you. So that is one way. I mean, the regenerative injection therapy is, just now I told you, the CAR therapy, where you take the person's blood, harvest the T cells and give it back to the patient. That is basically for lymphomas and leukemias. So again, stem cells are actually undifferentiated cells. They have not differentiated into any particular cell. So it's a group of cells. They are self-dividing, but they are self-dividing. They replicate themselves, and then you can say it's just like cancer cells. They keep on growing. But this one, in these stem cells, they do not go to other parts of the body, cause a lump or anything like that. So if your nerve, say if you got nerve injury, so okay, you can see the stem cells there. If you got nerve problem, like Alzheimer's, or you got Parkinson, the stem cells will go and try to help the nerve. By chance you get a heart attack, the stem cells will go to the heart and help the heart. So stem cells can divide to anything, whichever is required by the body. Say you have a muscle injury, the stem cells will turn into a muscle and help you. And at the same time also, if you got liver issue, you got cirrhosis, or you got any other disease, then your stem cells are depleted. So these stem cells will go and help. So stem cells are actually like police. They are monitoring your body. Wherever is required, it will go and become that cell or become that organ. So they are undifferentiated cells. So these are the potential diseases which you can try stem cell therapy in heart disease, stroke, COPD, respiratory infections, more about Alzheimer's and Parkinson. And I think this one should be looked into, because at the moment the treatment is quite limited. And also there are limited treatments for dementia, which needs other than stem cell. You need other things to sort of, so the person doesn't get dementia. So old people must keep their mind active. Let them do things. I think the lockdown for 2 years was a big issue for old people. Like young ones, all we used to still go and walk around and all that. And there was at that time, no visiting. You cannot, no interaction. My mother was staying with me. She herself, for 2 years, After that, she was already having a bit of dementia. But after 2 years, her dementia became quite bad. So because I couldn't take her out anywhere, can't socialize. So these are the areas where your stem cell can help you. This one looks like, can be used for anti-aging. When you give chemotherapy to a patient, you also damage certain tissues. See, chemotherapy doesn't differentiate between cancer cells and non-cancer cells. So certain chemotherapy can go and cause all these side effects. Now this side, but because body is under stress during the cancer treatment, and then the stem cells are very low, and patient will have more side effects. There's no harm in trying some stem cell therapy together with whatever you're giving to the patient. No, I think the Ministry of Health is also doing, in China, in India, they are doing combined therapy, traditional complementary medicine, TCM. The last I thought there are only 5 hospitals. In the government hospitals also you have TCM. One of the hospitals is Likas. But just now I spoke to Tan Sri. Initially I know there were 5 hospitals in Malaysia where the government allowed TCM. So this is one field we have to look into, whether we can use this TCM in oncology. You see, maybe you see nowadays the cancer drugs are very expensive. If you go for immunotherapy, target treatment is about 8 to 10,000 a month, and you may need up to 6 months to 8 months. And then if the relapse, you get a relapse, then you need more money. As you get older, your money also, the bank also balance is getting less and less. So, you have to look for your family support. And so side effects of chemotherapy itself, there are certain we try to be very careful so the patient do not have side effects. In spite of being careful, even how careful you are bound to get 5% side effects. Like certain cancer drugs can damage the heart. Certain cancer drugs can damage the kidneys. Certain cancer drugs can damage the lungs. This is something to look into in the future. Here we got immunotherapy. Now cancer treatment, we are having the normal chemotherapy which we have, plus we got target, and then plus immunotherapy. But before we use immunotherapy, we do the checkpoint check inhibitors. That means which type of cells actually are those cells, and which immunotherapy is going to help. All you're doing is you're injecting an antigen to create more antibodies. So that again, I think if immunotherapy can be used, then why not stem cells? Is the same. Actually, in theory, I'm not saying the same. It is just like same. So I think this thing also we have to look in the future, whether we can decrease the dose of target treatment and the dose of immunotherapy and combine it with stem cells. This is something we have to look into, which other countries are already looking into. They are far beyond. Taiwan. Next speaker, Prof. Su is from Taiwan. In Taiwan they are using TCM and together with conventional treatment. So that makes sense. And Korea, Japan, they all using TCM together with conventional treatment. In Malaysia, we are strictly bounded by protocols. We strictly follow by the book, and sometimes I think after working for 40 years in oncology, I think there's more you must look into more rationally, whether really, because all these trials are done in Western countries. You must also know, next to the car industry, the pharmaceutical is the next industry which makes money. So we have to be very careful. Okay, just now I was telling you checkpoint inhibitors. These are special tests done to see which type or subtype cancer cells are there in the body. So you can target them so that the cancer, the cancer cells will die. So we know CAR T therapy, we know, which is well established, but only unfortunately limited role at the moment. In KL they do the CAR T therapy. In Sabah we don't have facilities for CAR T. So this is where your cell, they take your blood, they remove all the T cells and then put it back to the patient. So these are types of immunotherapy we have. So at the moment we are looking into these cancers at the moment: bladder, cervical, colorectal, kidney. Triple negative breast cancer is bad news. Really is one of the tough cancers to treat. And we know cancer of the breast is quite common nowadays. And at least 20 to 30%, I think they are triple negative. So the future of medicine as stem cell therapy with adequate research can have potential to treat chronic conditions that have no cure. This leads to better disease management, increased quality of life for patients and family and members. So, basically, a lot of the stem cells which are being marketed outside is for health reasons. How do you increase your stem cells in the body? As you get older, the bone marrow is getting less active. Exercise and healthy lifestyle. Don't smoke, drink in moderation, do everything in moderation. I think one should enjoy life also. So then the stem cells you can use, this is between you whether you want to give a trial for anti-aging. I am being the co-founder for the Sabah Healthy Aging Society. So the idea was to give seminars, advise people how to grow, how to age gracefully. That means you age but you still mobile. Sometimes you cannot do it on your own because you are deprived of, because you can't exercise much. Especially when you get older, suppose you got nerve disease or you got spine problem, your bone problem, your mobility is less, and then you can't exercise. Then if you can't exercise, your mobility is less, what are you going to do? I would not advise, but you can give a trial of stem cells in your body for a healthy living. Okay? There's no harm in trying. There are people there who spend, one injection in Singapore of stem cells, I don't know what they use, it 100,000. So the stem cells is very expensive treatment outside Malaysia. Malaysia still at the moment, due to restrictions from the government, we are not, there are a lot of companies selling stem cells, but we don't inject stem cells in the body for health purposes. What are the foods contain stem cells? Cauliflower, broccoli. These are two things I could look at the literature where you can actually have stem cells. So take more cauliflower, take more broccoli. Now, I think I'm coming to the end of my talk. The maximum place where you can get stem cells natural is from when the baby is delivered, the blood from the cord has the maximum stem cells. Now there's a lab in KL, you can store the blood in the lab at the temperature which is minus 190 degrees centigrade. Celsius. I'm talking about centigrade. That is radiotherapy calculation. So it is 190 minus 190 Celsius. So, you can, I mean, now it's too late. I see the crowd, I think you all have already all delivered ready. You can go and pass this message to a younger crowd, whoever wants. Later part, you can use the blood for yourself. And the chances of rejection are less because it's your own blood. It's your own baby. The chances of rejection are less there. Okay. So, that is, I come to the end of my talk. And stem cells is a very, actually, it is, we know very little about stem cells. A lot of people have not done any clinical trials. So whatever we are using is, I think this BioLife is the only stem cell company I know. They are doing research and they are helping UKM, like Dr. Angela, to do some research. So we need more research, and we need research in oncology.